Welcome back to Season 2, Episode 7 of In Pursuit of Purpose Podcast. I am your host, Marcus, or Obeng if you like. This is going to be a great show. I can promise you that. I always keep my promises. I thought you knew that. Welcome back to the show. Yes, you made it in here. I'm so glad that you are here. I am here because we have a great show before you. This show is, you know what it's all about. It's about bringing nothing but the truth, more so inspirational truth, to fire you up, to live your life, to do what you were put here to do, to pursue your purpose, pursue your passion, pursue your calling. This is why you came. And so I have brought on the show today for episode 7 a great man. His name is Dr. Abdel Alkhalouf. He is a doctor in oncology studies and science and all this, nerdy terms and stuff that I cannot get out right now because he does have a bio that you will hear when you listen into the show. Now, this show is brought to you today by what? My website, www.sweatforsuccess.wix.com/my site. There you will find all of your Obeng meditation services that you may need. $5 consultation if you need that for a quick pep talk, or just some other resources like books and other knowledge that you can gain from just my story. Go there, get a backdrop on who I am, what I do, what Obeng Meditations is about, and use us. That's why we're here. And we're here with this podcast on this platform for a reason as well. So get in here, get tuned in, listen up, because this is going to be what you need. Now, we're about to bring in Dr. Abdel. So I want you to stay tuned, download the show, share the show, and subscribe to the show, the podcast, because that's how we continuously get found. And that's how we continuously get to bring you very great guests. Because once they know that this show has a listenership, they would be more likely and willing to come on to the show. So you must do your job in downloading the show, sharing the show, talking about the show, and all of that great stuff. Subscribing too. Okay? All right. I will see you in on the other side. Here is Dr. Abdel. Enjoy the show. Welcome back, everybody, to In Pursuit of Purpose Podcast. I am your host, Marcus. They call me Obeng around these parts, and you already know that we are in Season 2, and this is Episode 7 of the show. Now, I have the great honor and privilege to have somebody on the show with us today who is going to be bringing something I like to call a book, a dictionary, an encyclopedia of knowledge. He has very, very good heart and very, very well intentions to bring us this knowledge. And I want to be able to bring him to the platform of In Pursuit of Purpose podcast and the audience. So I'm going to be introducing you to none other than Dr. Abdel Alkhalouf. And Dr. Abdel is the founder or the co-founder of Feel Good Forever Natural Supplements. Dr. Abdel has extensive research, teaching, and clinical experience in the field of oncology and palliative care. His passion for bringing science-based natural health supplements to those who need it has led him to FGF USA. Dr. Alkhalouf is now the Chief Scientific Officer and co-founder of FGF USA, a company providing the finest natural healthcare products. Dr. Alkhalouf was the head of research at the Association of Natural Health and the director in Bremen Health Clinic a comprehensive natural health clinic near Atlanta, Georgia. He completed his PhD at the University of South Florida and has received world-class research training at Moffitt Cancer Center and at Temple General Hospital. Let us bring in a warm welcome for Dr. Abdel. How you doing, doctor?
Good, Marcus. Thank you so much. Thank you. Thanks for the introduction. And by the way, Bremen, it took me 5 years to say Bremen the right way, so I don't don't blame you. Especially with my accent. Oh my God.
Took you 5 years to say it the right way, huh? Oh,
exactly.
Wow. Oh, wow.
Exactly.
Doctor, I just want to thank you for joining us. And I want to basically ask you, we're dealing with COVID-19 right now, and we have a lot of people living in fear. And so one of my premises for bringing you on was to kind of just take away some of those fears and why we have those fears and why they're not really that what's the word, heavy. We shouldn't have them, so we shouldn't let them weigh so heavy on our hearts. So
Well, yeah.
go
Thank you so
ahead.
much, Marcus. Yeah, that's a tough way to start an interview. It's a tough question to answer. I wish we have the direct answer, but I'll do my best
Mhm.
to give you my opinion. And do I have to be politically correct? I don't have to,
Yeah, you don't
right?
have to on this show. You don't have to be politically correct. You just have to answer, and you just have to be well adept, Abdel, Dr. Abdel. You know what I
No,
mean?
it's amazing that I went to school for many years. Okay,
Yes.
in between the 3 degrees I've been to school for 12 years. I practiced in the Middle East. I practiced in the United States. I've got so many hours of continuing education, and I read. I do research. I think I know, and I think I know stuff, and I'm in the medical field, and then suddenly I start listening to the media right and left,
Mm,
and I get confused myself. So
yeah.
how do I expect that my mom or my kids or my wife or my friends will not be confused after all what we hear right and left?
Mm-hmm.
And I promise you, at any point, if you listen to media and news and you listen to two different views, you will get confused in 15 minutes. So what's
Mm-hmm.
right? What's wrong? So I will just give you my opinion, and it's my simple um, interpretation of the situation for COVID-19, and it might be right, it might be wrong, it might make sense to you and your audience, and it might not. But in my opinion, this is a virus, just like
Mm-hmm.
any other virus we've got. But this virus is tricky. It's something new. We're
Right.
dealing with a new virus. We don't know exactly how it's gonna spread. We're starting having more ideas now. The more we're exposed to it, the more we're collecting data and we know about it.
Right.
But you hear a thing today, you hear a different thing tomorrow. It's going to
Mm-hmm.
be affected by warm weather and humidity. And then you hear, oh, no, it's not affecting it. And then somebody would say it can spread to 12 feet or 18 feet. And then the next day, no, it's just 6 feet. Stay home, go out, don't stay home. I want to go back to basic. I believe before we think about COVID-19, coronavirus,
Mm-hmm.
as a disease or as a virus cause certain symptoms and diseases, I want you to think about as simple as how to find the root cause of what's happening to you when you get exposed to the coronavirus. Go back and think about it. It's so simple. It's as simple as God created us in a certain way, in a perfect way.
Yes. Yep.
You're born, you're perfect. You have an immune system, that can fight anything. We go through life. We put mileage on this human body, right?
Mm-hmm.
So the organs are not functioning perfectly. The whole system, the whole computer system inside your body is not, getting fed correctly. It's not getting treated correctly. And then by the end of the day, the whole system is interrupted. So let's go back a little bit and think about our immune system. I believe if we just as simple as think about our immune system, make sure we have 100% effective immune system, then we're not going to think about, the COVID-19 or the corona. Look, just think about it. Look around you, Marcus. How much money we're depleting in the market now just for moving ships, for buying masks, for coming up with ventilators, for hospitals, ICU units, testing, and we're trying to figure out this virus.
Mm-hmm.
Guess what? Your immune system, if it was 100% effective, you don't need all that.
Mm-hmm.
We're going to save all that money.
Mm-hmm.
And how much it costs to have a good and perfect immune system? How much?
Mm-hmm.
Nothing.
Mm-hmm.
Zero.
Right.
I always say how much it costs for you to go out and walk and exercise. Zero. You don't have to be fancy and go to the gym. You don't have to buy a Nike shoes, $150 in order, to exercise and have good fitness. Just go out and walk before they put tax on walking. It's
Mm-hmm.
free. Go out and exercise. Eat good food. Healthy living or healthy lifestyle doesn't cost much. And you're the master when it comes to thinking about meditation. How much it costs you to wake up 6 in the morning and sit and meditate?
Mm-hmm. Yes.
So it's healthy lifestyle. We think always it's I cannot afford it. It's not for me. Guess what? It's the cheapest thing. So just to summarize, your immune system. Now, this is what you have control over. You don't have control over big companies manufacturing ventilators.
Mm-hmm.
You don't have. It's a big mess going on between governors and government, and everybody is doing a great job. And our doctors, our nursing, everybody has good intentions. But do we have control over those decisions? No. I have control over my body, what to put inside my mouth, how to exercise, how to boost my immune system. Think about coronavirus, as simple as that.
Wow. That was pretty good, Doctor. So what are the top causes of diseases in our communities?
Well, there are, based on research and different types of research that done in different settings, they have different ranks for what causes diseases to start with. So before I tell you exactly what are those causes for diseases, I wanna use one illustration to explain how did I ended up thinking that me and my colleagues that these are the top 10 or 5 or 3 causes for causing disease. And please, I'm not trying here to show that the medical field or alternative medicine or allopathic modality, there is a place for everybody. Okay,
Mm-hmm.
There is a place for everybody. Everybody is doing great job. I just want you and your audience to think with me in an open mind setting.
Mm-hmm.
We've been trained in allopathic medicine, in traditional medicine, here and everywhere around the world in certain way. You see this patient, you collect these symptoms, you do this evaluation, you give this diagnosis, you send them home with those medications.
Mm-hmm.
Okay? And it's all was built based on mainly 2 things,
Mm-hmm.
liability and the insurance paying you. So if we come to the emergency room and I'm talking to you and you have chest pain, I have to do certain cardiac enzymes. I have to do AKG. I have to do 1, 2, 3, 4. because otherwise I'm liable. If something happens to you, and I'm gonna be, my license will be jeopardized, my whole future will be. So I have to do this to be safe, in the safe side. So liability, and I have to document it certain way. And because you said the magic word, I have chest pain, I have to do this and this and this, and send you home with this and this and this. Because otherwise, the insurance company is not going to pay my hospital for treating you this way. These protocols was designed again for liability issues and insurance issues. Is it a bad thing? I'm not saying it's a bad thing. There is a safety comes with that. There is. My only point is just to be open-minded when we look at our patients and clients. Just to be open-minded for other things before we decide to send people to their homes and with a bunch of medications.
Yeah.
Let's check if they can change something in their lifestyle.
Yeah.
Let's look at the human as a whole. It's not the physical symptom itself. It's physical. It's spiritual. It's all aspects. Of your life and you're a human being. So back to our question. So instead of looking at the symptom, let's cause people come with symptoms, but if we dig causes those diseases, I can just simply say three things. It's your GI health, your gastrointestinal health, your gut health. It's a main reason why we have all these problems. Your circulation, your heart and the arteries and veins. And the third thing is your excretion, your kidneys, your liver, your spleen. So I want to simplify this thing. You eat. If you're eating good food and picking good choices, for your life, and you're not absorbing the nutrients, your gut is not working perfect. I don't want to get into details of acidity and how to fix that. It's just as simple as take care of your health, of your gut health. You absorb good nutrients from your food. Excellent. We've got the nutrients, but the nutrients are in your bloodstream now. Where do we want them to go? We want them to go to your cells, all over, to your organs. So you need a good circulation because your blood is going to transport those nutrients all over. You've got those all over, and then you have metabolism, and you have toxins, and you have unneeded stuff from what you put inside this mouth. So you need it to go out. So your gut, your kidneys, your liver, your spleen, they will excrete and get rid of those toxins and get them out. So simply three root causes. I'm going to start with just saying your gut health, circulation, and your detox system or your excretion system, kidney, liver, and spleen.
Okay. All right. Yeah, I think that like you said before, the easiest parts of a good healthy system are the things that cost zero to do, with walking and meditation. How much does it cost to wake up in the morning and do these simple things? But I think the fear from, like you were saying, the media oversaturates the the voice out here. So we're all planted by what's coming out of the media, and then it just permeates throughout all of the communities. And so people walk around, as if every single person has this COVID thing, and it makes you feel quite uneasy. You know what I mean? Because everyone's looking at you like you're the one that got it. You know what I'm saying? And if you don't wear your mask, you're the one that don't care about life or something like that. And it's just like, I'm not ready to just give in so easily to the news. I'm not so ready to just give up. I'm not so ready to just allow myself to be, handed over to these to the news outlets, to the media outlets, because whatever your political ideology is, there is a lot of, Trump did coin the phrase fake news. There is a lot of fake news out there. And so we have to really just understand that, yes, we do have a perfect immune system. We weren't created, to get sick in a sense where this body couldn't handle it. And so I just want to go on that, continue on that part. When I say that and I state that, I want to ask what's on top of mind or top of the mind, which is like food relationships, general health, given this global pandemic. What is the answer for COVID-19? Even though, we've mentioned this a little bit before in person, but what is the answer for COVID-19?
I will go back and say, take care of your immune system.
Mm-hmm.
Take care of your body. It's very important. Now, I use the illustration of the car, and excuse me, but it tend to be easy. We used to use it for with clients and patients. So you buy the car, it's brand new, it's working fine. You first thing you do, you put good gas in it, right?
Mm-hmm.
That's our human body. You put good gas. And I'm not trying to be ideal here. I love Popeye's chicken sandwich, but I cannot eat it every day, right?
Right,
we,
right.
we do our due diligence. We do our best to eat our fruits and vegetables every day. We do our best to think. Just think about the choices you put inside your body, because if you put 87 gas, you're not gonna get the same performance as the 90 or 93, right?
Mm-hmm. Right.
So we go through life. This car put mileage, right?
Mm-hmm.
After a while, there is a degeneration. You're gonna have to go and change some parts, do some maintenance. We always come back to our human body too late to do this maintenance.
Wow.
After we put so much mileage on it, we're in our 40s and 50s. Oh, everything is falling apart. Guess what? You did not take good care, of your car, during this trip. It's a long trip. It's not only, and add to the physical, the car, moves. That's physical, right? Movement.
Mm-hmm.
We do the same. We put mileage, but add to this stress in life. Add to this, the emotional and, the psychosocial aspects of life and how much stress we have around us in a just regular day. You have a family, you might have a life partner, you might have kids, you might have brothers and sisters, you might have a mom. Just thinking about them, where they're gonna be in life, are they gonna be fit today or not? Are they sick that day or not? Are they being able to pay their bills? And that's stress. Before you start your car and go to work, thinking about your boss and thinking about, the work requirements, and then going back home and then paying your bills. And you know what? Look, right and left, we have stressors on daily basis. Mm-hmm. We got used to them. And Marcus, I know this is your field, and I want to talk to you about this and trying to use what you have, the gift you have. And I would really recommend for everybody who's listening to find a venue to work on emotions, to work on stress, because back to this car that we're putting mileage, you know what happens when we're under stress? Our minerals are depleted. And those minerals are our sponges for our, water. If you don't have enough water, you don't have enough, hemostasis and balance in your body. I'm under stress. I'm thinking I am. And sometimes subconsciously, we don't realize how much stress we have around us. I'm depleting all my calcium and magnesium and manganese. I'm drinking water. It's not staying there. Those sponges, those minerals are out. Plus, those minerals are part of many, biological, I would say, acts inside your body. They're needed. You don't have them because of stress. So we ended up adding to the stress because physically we're tired and exhausted. So we're adding to this mileage, and we end up 40s, 50s with all these symptoms and diseases. Simple. Go back to making sure you eat good, your circulation is good, and then you have good excretion. I don't know, Marcus, if I can share some slides with you and your audience.
Yes, yeah, go ahead.
I'm not gonna go into details. I just
No, go ahead.
wanna do a comparison between what's traditionally we've been using in the medical field and how we can be open,
Yes,
having open-minded and using people like you with your talents, people in the alternative modality, and add to what we have in our lives. So let me see if I can do this.
yes, please share some slides with us.
Do you see this?
Yes, I do.
All right, excellent. I promise you I'm not gonna take much, but
It's
let me
okay.
see if I can do. Okay, so it's just again. Why do we need to address the root causes? And I like what you asked me. What are the main reasons for what we have in life? We need to think about why do we have all these problems in order to fix them, right? Instead of looking at the symptoms and diseases, I want you to think about the root cause of the disease. Because if you have a flat tire and you put some air in it every morning, it might take you to work and you come back. You wake up the next morning, you're going to have to do it again, right? So that's when we treat symptom and disease. You go to your physician and you have a heartburn and you have acidity. They will give you this magic pill. You go back home and you take it every time you have this. Let's look at the root cause of that problem. Why do you have flat tire? Let's just take the nail out and fix it, and you don't have to fill that air every day. You don't have to take that pill every time you have that symptom. So I just want, all of us to think about how to fix the root cause of the issues we have instead of just masking symptoms. Okay?
Okay.
And again, we have a place for everybody. It's just when you go to somebody like Marcus and you're doing meditation and you're healing patients and clients and you're healing the healers by looking at important aspects in life, you're looking beyond the physical symptom. And this is what I want people to think always when they talk to their physicians, to their doctors, when they go to I want them to think broader than just having that pain in the knee. I want you to think about, I did a study back in the days. I'm not that old, but a few years ago, I did a study about it had to do with constipation and cancer patients. We used to ask cancer patients on a scale of 0 to 10, for example, what's your pain level? How many times you have constipation? That's the symptom. But then we never. I don't want to use we never. Some people they're doing this. We don't look beyond the symptom, the distress of that symptom. If you have, Marcus, if you have a pain that's 6 out of 10, okay, and I have pain that I think it's 6 out of 10. But guess what? You wake up, you go to work, you take care of the house, you take care of the needed things, and you go back home and you're doing life. You have the same level of pain as I do. But with my 6 out of 10 pain, I cannot move. I don't want to talk to anybody. I'm just sitting at home. I'm depressed. I have pain. And so my interpretation for 6 out of 10 is different than yours. And it's going to influence my life in a different way. That's the symptom distress. I cannot just look at my patient and give them medication because they have 6 out of 10 and treat Abdel as much as I treat Marcus. There are other aspects of that symptom. This is what the message I'm trying to deliver. Unfortunately, because of the workload we have at our hospitals, uh, there is a big issue with misdiagnosis. And again, I told you, we've been controlled by liability and insurance requirements. So many medications in the field. I'm going to show you a couple of slides to show how many medications for each disease and how do we pick out of those, and this is sounds like scary. I'm not trying to scare, but 1 in 20 adult outpatients is misdiagnosed in the US every day. 12 million.
12 million.
Is diagnosed, is that an easy number? That's not an easy number, So nationwide, 12 million misdiagnosed. Misdiagnosis means mistreatment. So I don't want to go much into details. I just want you, again, to be always open to other modalities, open to what other people do, and even not only clients and patients, even practitioners. People are sick and tired of being sick and tired. And practitioners are sick and tired of being people sick and tired as well. So we need alternatives. I'm not saying replace the medical system, just be open to other modalities. Be open to, other things. For example, depression, it's a major contribution to global burden, and based on the WHO, and it was supposed to be the fourth leading cause of disability in 2020. So just think about depression. What causes depression? All these medications that we have on the slide causes depression. Cardiovascular drugs, antiparkinson, anti-infections, hormones. The list is look how many medications causes depression. Okay, we've got the medication for heart problem. We ended up with a bonus. You got a depression. So what do? We use all these medications to treat depression. 117, and this is an old source, maybe there are more than now. So we use 117 medication to treat a disease caused by 150 other medications for different symptoms. And my issue with medication, again, there is a place for everybody, and I don't want you to put your medication on the side now. I want you to think. Just look at the group's markers for medications.
Okay.
The antidepressants. Every medication, look at it. It's beta blocker, inhibitor, suppressor. So it's blocking and inhibiting what? It's inhibiting and blocking biological pathway that God created in this body. So when you block that, you're going to have a side effect. When you block beta cells, you're going to have a side effect for that. This is why we have side effects from medications. But I'm not saying to leave a patient with depression, let him go and commit suicide just because we want to fix the root cause of the disease. Just be open, keep him on his medication or her medication, start working on other aspects, psychosocial, emotional, fix the root cause of the depression he has, and then, or she has, and then go back and stop the medication for your clients and patients. So I cannot highlight, the emotional work and meditation and taking some minerals and vitamins enough. Unfortunately, I would love to say, go ahead and take your supplements and vitamins.
Take your supplements, okay, yeah.
Through your food. I would love if we can just take food and get what we need. But unfortunately, the quality of food we have, our lifestyle, put us in a situation that we need to supplement. Go and check your vitamin D levels. It's low. I'm not trying to scare people here. I'm not trying to just make sure, everybody is buying vitamins, we're selling vitamins. No. Make sure you eat your fruits and vegetables. The best ideal situation is to get your supplements through your food. Get your vitamins and minerals through your good food. But be always open to doing testing. Make sure you're not missing vitamins and minerals, supplement, bring your immune system back to where it should be.
Right. So that was a pretty good presentation, Doc, because I was able to understand exactly what you were saying. Can you help me understand what do you think? Why do you think natural supplements are linked to our emotional
Well,
status?
I'm glad you brought this. It is as I said before, emotion and stress, and you see this on daily basis, Marcus.
Mm-hmm.
You see your patient; they're exhausted. You know, they're they have tension, they have emotion problems. They're exhausted physically because of that. Why? Again, I'm going to go back to the point of minerals. We deplete our minerals when we are stressed.
Mm-hmm.
We lose our minerals, we dump them out. Okay, and those minerals, because of stress, we're losing them. And if we
Mm-hmm.
lose them, we will have more stress. Why? Because our adrenal, our
Mm-hmm.
thyroid, our all our glands, they need those minerals. It's the food for those glands in order to make sure we have good hormones that helps with emotional stability. So we go into the circle. you know we lose our minerals because of stress.
Mm-hmm.
We have problem with our organs. We have more stress, we lose more, so we go into the cycle. So I would recommend for people with emotional problems to make sure they get enough vitamins and minerals on the side of doing treatments, emotional treatments, because it's very important.
Hey guys, pardon the interruption. Simply because of COVID-19 and the social distancing thing that we are all practicing right now, every episode of season 2 has been done through Zoom. And so we've been conducting our interviews through the internet. And when you have so many people using an app like Zoom, it tends to have to continuously upgrade itself. And so, therefore, I am here with this short little miniature break to tell you that in the middle of our conversation, of me and Dr. Abdel's conversation, Zoom was uploading on me, so it cut us off in the middle of our interview. And so, no need to panic. I am bringing Dr. Abdel back to the show for the second half of it. And so, you will be hearing the next half coming up right now.
So make sure you find the right thing for your body. There are so many good products in the market, but there are so many mm, questionable products in the market. So make sure you get the right thing. And I said CBD is amazing and is great because there was a study, we're in Florida. There was a good study came out of University of South Florida. And I'm not biased because I'm a graduate from there, but go Bulls, right?
Go Bulls.
So
Hometown.
what I'm saying is they're doing focus studies on CBD and the effect of CBD on autoimmune, on inflammation, on cancer, on many things. And I talked to one of the guys who is working and is collaborating between some universities in the United States and in Australia. So they have a testing hospital in Australia where they let cancer patients do the smoking of the marijuana to get the CBD. And in his opinion, in that researcher opinion, God created this plant in a certain way. You have to
Wow.
get everything from it, and they're getting good results, but nothing out yet that we can claim. But what I'm saying is, and under extensive research, you're gonna hear, in the future that CBD does this and does that, and we just hear good things about CBD. So it's working, in a magical way. That same guy I'm talking about said something. I said, so why would you take it? Why would I ask my clients to take CBD? Because how do I link it to certain diseases? He's the expert, right? He said it just makes everything better. It makes you absorb other vitamins and minerals, better. I'm not claiming that now. I'm just saying what the experts say, but it tends to be good. And that brings me back to one more thing about, being just on a medication side or being open to other modalities. Just CBD, I did not see any side effects from my day-to-day observations. And this is why we need to be open-minded as practitioners, as clients, and as patients. We have to be open-minded, because guess what? If you drink your green tea, I don't think it's gonna affect you in a bad way. You're not gonna get a side effect from that.
Right.
But be careful with the amount of vitamins and minerals you're taking, or CBD, because the more is not the merrier. Just ask your practitioner, do your work, do some research. Information are everywhere on the internet, and you just search it and try to find a reliable source to answer your questions.
I see you have meditation listed on there. How strong are you of an advocate for meditation as a way to deal with health epidemics and things like COVID-19?
All right. So honestly, I started traveling when I was on my early 20s, and I was working with a cancer consortium. It's called the Middle East Cancer Consortium. So it's like-minded people. We get together. We used to meet in Cyprus or Turkey or Jordan, so we have those meetings, and we have people from 7-8 countries, right? And we just discuss the cancer issues in the Middle East. We discuss palliative care, hospice care. And during those sessions, they used to do some meditation, healing the healers. So we would start our day with meditation. We do it in the middle of the day. But I was young. I was just, I just want to finish that presentation and go back and go enjoy the hotel and go to the water, and so I did not realize how important is this in our lives. The deeper I got into palliative care and hospice, and when I did my PhD and I started going to hospice centers and seeing not only clients and patients, practitioners, healthcare practitioners, doctors, nurses, nurse assistants, social workers, they're exposed to so much stress. They leave their jobs, they have compassion fatigue. And then I started realizing all emotional work, not only meditation, is very important. So we did a study, and in that study, we tried using some techniques like writing techniques, Marcus, and like doing meditation. And we've seen good numbers going. We've seen level of compassion fatigue going down. We've seen levels of compassion satisfaction going up. The burnout numbers are going down in that research. So I've seen it firsthand. I told you I need to talk to you because I'm just normal. I'm not very normal, but I'm just a human being who lives, on Earth and gets exposed to many things. Right. I need meditation. Yes. Again, I don't wanna reach to a certain level and certain age with high mileage, and all my organs are, degenerated because I'm depleting those minerals. I'm not doing my meditation. I'm not doing this emotional work. So I cannot highlight this enough. And I'm not going to talk about the meditation itself. You're the expert here, but I cannot highlight.
Yeah, I can just tell you for right now, how strong of an advocate I am for, but more so how it drastically just 180 my whole life, just shifted the whole entire ordeal of my life and what I thought I knew. And yeah, it's something that it's something that I push. It's something that I teach, and it's something that I'm strongly adamant about. And so I would definitely recommend meditation as a source. But how often should, if one is not practicing, how to regenerate, because you use the word degenerate, when we're introducing our bodies and our health to all of these stresses out here. And if one may not be able to sit still for meditation, then how often should one introduce other forms of regenerating their health system? Like, how often should one introduce supplements into their everyday immune function?
Well, that's a very smart question, and uh, the short answer: balance is a key. Okay, so balance is a key. We try our best to do our homework of picking good food and good food sources, and make sure our fruits and vegetables, the daily requirements, we're taking them. We have a balance in our food, and I'm not gonna get into details. I'm not perfect. I'm the first one to be guilty here, but I think about choices. I think about what to put inside, but sometimes I go crazy, but it should not be a lifestyle, Marcus. We should always be aware of what to eat, what to put in our bodies. That fuel is very important, and the results is going to be based on that. How frequent? I would love it if we can all do some kind of testing to evaluate how depleted and how deficient we are, from those, vitamins and minerals. But start today. Expose yourself to healthier lifestyle. If you have a good source, and I'm talking about adults here, I'm not talking about kids. Hopefully, parents are aware of what to give their kids, the choices, their milk, their vegetables, their food. Hopefully, school system are still taking care of the kids, and their food, because that's a different topic. I'm not gonna go into details, but expose yourself today. Give yourself a chance to do meditation today, because I promise you, you might end up finding that no, this is not for me. But I've seen it when I was the head of that clinic, and we had many modalities in that clinic. I was there for 7 years, and I've seen patients. You have to talk to them into doing meditation, or into doing therapeutic massage, because they never experienced, and they think they're immune. They think, I don't need this work.
Right.
I don't have emotional stress. But as soon as they try it the first time,
yes,
they realize how much they need that.
You don't even know. I know. Yeah. The stress that releases from the body just through meditation and therapeutic massage is, I kind of agree. I didn't know, and I thought I had I'm strong enough. I don't need it. My immune system is okay. I don't need no extra boost. I don't need no outside supplements. But, these minerals are here for a reason. These minerals are here for a reason that was given to us. These minerals in these leafy plants, you know what I'm saying? These things came here for us to aid us to have a better existence in life. And so, yeah, a lot of people don't think that, a lot of people think that these health administrators and these, the drug, food and drug administrators and those people up there, they think they got the answer. But we already know what that is fueled by, money.
True. Unfortunately, so I like this discussion, and it brings me, Marcus, to an important point. We work hard. We really work hard. Every single one of us, not only me and you, in this country. I look right and left. We really work hard. People really tired and they're working. And if you ask them why, because I want to make sure I have health insurance. I want to make sure if I get sick, how many times you hear this? If I get sick, I can get treated. I want to make sure I have a good retirement. So when I'm sick and I cannot work, I can afford a decent living. You know what? Step back. Think. I don't want you to be sick and have an insurance to treat you. Get the insurance. keep the insurance. Don't use it. Step back and think. Just give yourself some time to take care of this human body. Because if you're gonna reach to a retirement and if you're not healthy, you're not gonna enjoy your retirement.
Right.
So this is important. Bring a piece of paper and do your research and look at what you eat every day. And this apple, this banana, this sandwich has this much vitamin and minerals. And this is how much I should be taking daily. This is the daily requirements. Am I taking enough or do I need to take more? Am I doing enough emotional work or do I need to go and do more? We're not sleeping enough. We're stressed. We have to do many things in life. On the top of that, COVID-19.
Oh.
Life is stressful. We all agree on this. But you know what? Let's start with this body, with our health. Nothing is more important. Everything we do around, we do in order to protect this body when we get sick. I want you to prevent being sick. Think about it now. Keep this body and then enjoy everything in life and achieve and be a changing agent. And that just, if you allow me to say something, Marcus,
Yes,
I'm very proud of what you do. We've met in a public place and we both were impressed of what we both do.
Yes.
And God has a plan, but I'm very impressed that you're trying to make change in this life. It's not Abdel and Marcus. It's everybody is listening now. It's everyone. Start the change by you being healthy.
Yes.
You being strong. Take care of yourself, then take care of people around you. So we all can be changing agents and we all can do good to humanity.
That's good, Doctor. I want to ask you just 2 more questions before we get out of here, because I think this is cool. This conversation and discussion is really good, and I think it's needed. And I just want to ask, do you have any studies or any papers people can use as a reference to help themselves with more of this information?
Definitely. I can put together like basic information about how to supplement, how to pick your vitamin and supplement, and I can share it with you, Marcus, and feel free, please, to post it and distribute it to all your listeners and whoever needs it.
Do you think that this is the beginning of the end when it comes to personal spaces and social distancing? Do you think that this is here to stay, where we're not going to be able to gather in large groups and function as we used to do as a people anymore? Because this seems like this is going to be the new norm, to me, in my opinion.
It's very debatable, but we can agree on certain things.
Yeah.
It's not a light switch that you can turn on and off. Even if tomorrow they have a vaccine, it's not a switch that you can turn on and off.
Right.
It's definitely gonna change the way we deal with each other and the way we practice life. Definitely. How long it's going to take in order to come back to norm, we don't know. Is it gonna be ever the norm? It's gonna be a new norm. So I agree with you in a way. Life is gonna change, but the glass is half full,
Yeah, the glass is half full.
It's gonna change, but we have a responsibility as human beings to be always responsible, always kind, and always smart about how to behave with each other. I think at a certain point we're gonna go back to a little bit of old practices, but it's definitely gonna change.
All right, Doctor, that's pretty cool. I appreciate you really being on today, and I think that this is the new norm where people are going to be scared to really deal with each other. I do believe we'll come back into that space again, sports arenas, graduations, parties. We'll come back together in those spaces. But I think the fear it's going to sit in the back of people's minds. And so we're not going to be able to fully, to connect with each other on a really intimate level because of this thing. And that's going to be something that's not going to sit well with me because I'm a people person. I'm a social bug. I love intimate contact with humans, and it's just going to change a lot of the dynamics. And I think that that's going to be unfortunate for a lot of people, especially in the work that we do. So, you know, more power to the teachers and people like you bringing this awareness on how we can better our health, how we can take care of ourselves, and how we can, you know, immediately affect our immune system with just simple things like taking a walk outside and meditation and, you know, a healthy daily morning practice, something like that. That can change things infinitely for the better. I want a lightning round with you real quick. Just real quick, how can we decrease toxicity in our bodies to massively improve our health?
So the major organs for detoxifying is your kidney, your liver, your spleen. Other organs do help. Your skin help a lot. Your GI helps a lot. But make sure you drink enough water, you know. And if you don't drink enough water, and I did not say fluids, so so your coffee and your diet coke is not included. So water, drink water.
That's a fact.
Water.
Water. Yes. All right, doctor. What is driving you to get this message out?
Well, just when I meet people like you, and I see how much you care, and I see you're trying to make a change, and when you see it on your clients and patients, and you see the difference, you know what? Life is not does not we don't measure life of just how we're happy, me and you, but also on how others can be happy around us. So because of us, so family, clients, patients, friends, when you see them happy around you, that's a satisfaction in life.
Nice. All right, doctor. What is Dr. Abdel's purpose in life? What's your purpose in life, doctor?
I would love always to do good.
For all us to do good. That's good. That's good. How can people find you? How can people contact you? How can people locate you? And your supplements, your Feel Good Forever supplements. You want to touch on that, or you want to?
Well, I just wanna say a simple thing about supplements.
Yeah, go ahead.
It doesn't have to be my supplements to be good supplements.
Right.
If you need an access to supplements and information, you have Marcus. He's a healthcare professional, and he think about what to recommend for his clients. So always refer to people who care in order to ask them about supplements. And again, it doesn't have to be our supplements, but if any of your people is interested to look at our website, they can look at fgfusa.com, see the combinations we have. And then if they want to get them, we don't go directly and sell them to clients. We distribute them through professionals because you add an extra step of being conservative when you recommend supplements. So we want you and other practitioners to be in the middle of this relationship and pay attention of what clients and patients are taking. They're not taking more. They're not taking unneeded stuff. This is why I would recommend to go through you and other practitioners in order to get recommendations for needed supplements.
So they can find this, can they? No.
They can.
Or they can get this like in a seminar or something like that.
They can't as clients because again, I want somebody who's aware of health and health aspects.
Right.
Be in the middle and to get those products through them. Because I've seen, and it's not only my modality. Many good companies, they do the same thing, and I've seen people just dumping supplements inside their bodies. This month, I feel that I need supplements. They're taking for 2 months, and then they're not taking for 2 years. No, It doesn't work that way. The more is not the merrier. The quality of those supplements is very important, and some of them, they're unneeded. It's not just, we're thumping. So this is why I need somebody who's aware of health and health aspects, and to be in the middle of the relationship. We trust our clients, but I want them always to go through their, practitioners in order to get access to those supplements. And I'm sure you will help anybody who would ask to recommend good supplements. It might be something in the market and it's good and it's working. It's just you have access to Marcus, go ahead and ask him, because he's gonna tell you if it's good or not.
Okay. Well, I want to say right now to you, just thank you, Doctor. Thank you for. They can go to. Did you give out your website?
It's www.f as in Florida, G as in Georgia, F as in Florida, USA.com. So fgfusa.com. I think no, I don't have it here.
Okay.
Yeah.
So www.fgfusa.com.
Yes.
And FGF means feel good forever. I actually like the name of that. So, Doctor, I just want to say thank you for coming on to the show. I appreciate you for doing what you do, for bringing in your knowledge, your wisdom, your wealth of inspiration that you brought to the show that kind of help people become a little bit more enlightened in what we're dealing with here, how to take care of themselves. I just want to say praise to you and your work that you're doing, and just much success to your business and much success to your practices and much success to your events that come along, because I know that together we're going to be joining up, doing some things. And so I just want to help you to continue to do the work anytime you need me, anytime you need this platform, anytime you need to share information. I'm always going to be here for you because you were here for me. So thank you. Thank you. Thank you.
Thank you again, Marcus. Thanks for inviting me. It's an honor, and thanks for all what you do.
Yes, you enjoy the rest of your day, okay? We'll be seeing each other soon.
Sure. Talk to you later.
Yes, ciao.
Ciao.
Wow. I mean, really, wow. Wow. I just want to thank Dr. Abdel Alkhalouf for being a guest on my show. That was a very powerful interview. Just the information in it alone and what he was willing to give to the show, I'm thankful, I'm appreciative. And therefore, I'm thankful of you. I'm appreciative of you. Thank you for continuously listening to the show, constantly being a loyal listener, a loyal fan, downloading the show. Thank you for liking, sharing, subscribing. Any of you who do, I really appreciate you. So stay on the alert. In Pursuit of Purpose podcast is only going to get better and better and better with much better guests. So if you are joining the beginning stages of this podcast show, you are on the right side. Remember, self-health and well-being is our motto. I love you. I love me. I love us. And I will see you all in pursuit.
Life don't stop, we rock, we get it, we go. High up life, we winning too. Oh, even if life hit us with lows, I'ma still shine in the light like gold. Hype in the moment, I might fly high and I'm rising, I'm feeling I might cry. White rising according to my eye. Life has got me biting, I'm feeling like Mike Ty. Always hiding and running for my life. Problem nobody hear it cause I lie. Only hope that you looking when I fly. Pray to God that you looking when I fly, cause I'm a flyer. Show you life when it's higher. Lonely nights got me tied up. If I die, would you cry up? Looking at you cause I wanted to prove I can make it, but I'm stuck. Looking at you cause I wanted to prove I can make it, but I'm stuck. I'm the girls I'm fucking just saying, I'm fucking just miles up. I'm the girls I'm fucking just saying, I'm fucking just miles up, ay.
If I could go back in time, I'll tell myself the love you give others, you must learn, give yourself. I know I've made mistakes and I'm gonna make so many more. Just keep going.